2024 is well underway, so is cold and flu season. Here to cover some of the health headlines is Dr. Tyra Owsley from Leap for Health and George Nemho, the organization's Chief Operating Officer. Thank you both for coming in.
Thank you for having us.
You know, it seems like New Year's Eve and then New Year's Day and everybody, oh, we're going to get healthy. Let's start getting healthy because this is my New Year's resolution. But should we do that? I mean, how do we keep those resolutions? Do we continue throughout the year, and how do we do it?
I think the best thing that we should do is do things in moderation. Not to have overachieved goals that are unobtainable, that allows us to get rid of those things. Start with small steps, 5,000 steps a day. Eating healthy, taking the stairs as opposed to an elevator. Those are things that we can do to improve our health.
George, give me an idea of what Leap for Health tries to instill in people. You know, how does it work?
Okay, so Leap for Health's goal is to help people live a better lifestyle. That Leap for Health is a mantra that stands for this: living, empowered, and purposeful. If you live empowered and purposeful, again, a resolution would go out the window because a resolution is not a lifestyle.
Right.
Remember, everybody waits till January to do something, and then they stop by February and the gyms are back empty.
Exactly.
And available machines are wide open. So it's about changing the whole mindset and the lifestyle. And if you do it for yourself, then you do it for your family, we'll all be better off.
But it's not that easy to do, is it?
It's a choice.
Yeah.
As they say, because if I look at a personal goal I had many years back, I was 295 pounds.
This is you?
This personal.
You?
Right, diabetic, 295, wearing a size 54 pants. Went to the doctor, they said, we're gonna put you on insulin and other medications. I said no, and I left the doctor's office, came back 90 days, 100 pounds lighter.
Not 90 days later?
90 days.
What did you do?
Again, stop eating all the carbs and all the high sugars and the white stuff and left that alone and made a lifestyle change. But I had to go to the gym 3 times a day because I had to fast track and create a solution for my life, because at the end of the day, my mother and father both died of heart disease, and I didn't want that to be my mantra.
It's almost like scaring people into doing something, isn't it?
Yeah, health is wealth. And unfortunately, some people have to hear the horrible things associated with chronic conditions, such as diabetes. You know, if you don't get it under control, you could go blind. You could lose a limb. And those types of attacks to address a healthcare issue gets people's attention. I don't want to lose my eye. I don't want to lose my toe. So scare tactics for some populations, it works.
And January is probably a good time to think about it and maybe not have to go to the doctor and tell them that you're going to die if you don't lose 100 pounds. But that really got you going, didn't it?
Changed my life, changed my mind, and that's been over 10 years.
Wow.
It was over 10 years ago.
And it wasn't hard, was it? It was just
It's a choice, because again, at the end of the day, I saw the end result of my mother and father dying again at 52. That was my mother's age. I'm like, this is not going to work. This is not going to work.
How old are you now?
54.
44. Oh, okay. So 2 years ago,
Right.
she would have died.
Right,
Yeah,
and that
thank
was 30
goodness.
years ago, because she died when I was 21, so I
Okay.
said that changed my life. And
Right.
so I haven't had that problem since. And it's funny, I had a doctor visit, and the A1C was out of control again.
What happened? What did you do wrong?
Again, I went back to the white stuff.
Okay.
Sugar is not your friend. Sweets and salts are not your friend. So at 15.5 A1C, now I'm down to a 9. And then a month from now, I'll be down to 7. Again, taking control of your life is the message that we want to deliver in terms of, again, January 2024 and beyond.
That is true. You've got to take control of your life. And that includes things such as, you know, illnesses and things that we have going on, especially now. Now, you and I talked a second about cardiac health is different in the winter than it is in the summer. How so?
So what happens in the summertime, we are outdoors.
Right.
We have recreational activities. The sun is out. In the wintertime, those activities tend to cease. We're not as motivated to go out and run and be outside on the lake running as opposed to using our treadmill. So that's when we start to see cardiac issues start to increase, especially among women. Especially among women.
Yeah, it's the #1 thing that kills
Yes.
women. People think it's breast cancer, but it's heart disease.
Heart disease.
Definitely. So what should we be doing?
We should be monitoring our waistlines. We should eliminate salt. We should eliminate sugar.
When you said waistline, I went, okay. Yeah. Salt and sugar, the white stuff, like
The
you
white
said.
stuff, yes.
And the sad thing is that it tastes real good.
It's delicious.
We have to come up with an alternative way and do things in moderation. Not to eliminate it forever. You can have a cheat day, but do it in moderation.
Right, not
Measure
every
those-
single day.
Not every single day.
Yeah, you know, we're just coming off the holidays, so there was a lot of white stuff going on during the holidays. days, and that's a good time to have fun. But then you come right back, and you get yourself together. A lot of people are talking about COVID. It may be bad again. They're masking back up again.
Yes.
They forgot about it. They were happy. They threw their masks away, and they were happy. But you really should be aware of what's going on amongst you.
And I am a proponent of a person who says, if you want to put on a mask, put on a mask, but also get vaccinated, get informed regarding your health and your immunity to prevent COVID, flu,
RSV.
Yes.
Yeah, and there are vaccinations. You can go just to one of the local pharmacies to get something like that.
Absolutely.
And quickly, let's talk a little bit about how everybody wants the quick fix in losing weight. You didn't do a quick fix. You didn't do Ozempic or some of these other drugs. Should they stay away from those? I know that they're for people with diabetes, but everyone's grabbing a hold of them.
Because everyone wants a quick fix, a microwave, the small waistline, the muscles. But at the end, if you don't continue with that or modify your lifestyle, it's going to come back. It's going to come back.
And that's not healthy, really, to do it, because you did it the right way. You didn't do the quick fix, because the quick fix is quick, but it doesn't last long.
And really the secret sauce is I was in the gym 3 times a day, burning 1,000 calories. That was my thing. I got to hit 1,000 on that treadmill 3 times a day, because 1 pound is 3,500 calories. And again, if you look at the math will always be true to itself.
You were really scared, though, so that makes a difference. 3 times a day is excessive, we should say, but maybe 3 times a week, right? For folks.
I would promote 5 times.
Okay.
5 times.
Oh,
a
really?
week. Yes, 5 times.
And people don't understand, strong is the new skinny. Being skinny is not what it's about. It's being in shape and being healthy.
Healthy.
And people need to realize you may be a little overweight or look overweight, but you're healthy because you're working out. You're eating the right, because not everybody's going to have the same body shape.
Right.
It's unique. It's
And
definitely
you can use the time frame for early morning. Do a little bit in the morning when you get up. Do a little bit in the evening before you go to bed to help balance that. So you're not looking at, oh my goodness, I got to spend 30 whole minutes, but just a little bit and a little bit, and it adds up.
But I like lifestyle. It becomes your lifestyle.
Right.
You don't want, like brushing your teeth every day. You exercise.
Absolutely.
You eat correctly. It just becomes a part of you, doesn't it?
It has to.
Yeah.
And it also helps reduce stress.
Stress, definitely.
Other factor.
Yeah.
All right. Thank you guys so
Thank
much. I
you.
appreciate it.
Thank you for
Happy
having
New
us.
Year.
Happy New Year.
No, you
too.
gave us a lot of good information. You can find more information at leapforhealth.org.